Hello, everyone. Welcome back to Pre-Med Radio. My name is Neela Bandla, and I am the host of the show. Today, I am joined by the spectacular Kaitlyn Wilms, who is very interested in medicine due to her experience in sports and also just specifically interested in the ICU ER part of medicine. How are you doing today, Caitlin?
I'm doing good. How are you?
I'm good. And so I guess we'll get started with the interview. My first question for you is, could you explain the backstory into why you wanted to go into medicine?
Right. So, one of the things that I think we all do as kids is you kind of search up your origin of your name and all that. So, I was just Googling on one day and I was maybe like 12 years old. And I found that my last name, Wilms, is actually a pediatric kidney tumor. So, it turns out one of my really far relatives along the line discovered the tumor and named it after themselves. So, generally, my point of bringing that up is my family has a lot of history with medicine. I'm definitely not the first one in the line. And particularly along that stance, probably a week after that, my golden retriever got diagnosed with cancer. So I have this constituency of cancer diagnosis popping up in my life. And as a kid, of course, I was like, I'm going to find the cure to cancer. This is what I'm going to do. So for a long time, I wanted to go to vet school. And I actually volunteered at the SPCA, and I found that animals are not really my thing. I like the medicine side of it, but there's a lot of abuse when it comes to animal shelters, in particularly. Not to say that isn't in human medicine, but it's it's always there for the animals. So I just wasn't a huge fan of that. So, and actually, the main part of why I want to be part of medicine really kicked off my freshman year in high school when I got a call from my mom in the middle of the school day, and my grandpa had been diagnosed with cancer.
Mhm.
Well, I ended up leaving actually school that day. I finished my finals in Ohio in the hospital room with my grandpa because the doctors didn't catch it early enough. He was not going to make it past probably 2 weeks. So we were all crowded, probably 30 of us, in one little tiny hospital room for about 2-ish weeks, maybe a little less than that. And from that point on, I was basically living in that hospital room. And that gave me a ton of perspective on what really goes on medically. So I guess we'll talk about that first. My grandpa, this had been going on for a couple months. He'd been showing symptoms, but his doctor kind of, in a way, said, "You're too old
Mhm.
to receive help."
Yeah.
And the doctor disappeared off the face of the earth. So
Yeah.
when when there were signs that they probably could have done something, there wasn't anything done.
Mhm.
And so it kind of set me on this journey of why are doctors going into this field if they aren't actually here to help. So I got invited to a medical conference in Berkeley, and this was my summer of my junior year. Rising junior, summer of my sophomore year. And it was really good at introducing all kind of aspects of medicine. And the one that kind of really stood out to me was the ER example and with the ambulance. So I really liked that, but it gave me a lot of overview on really the possibilities of medicine. And that's kind of when I transitioned into human sciences.
Yeah.
With that being said, I have a senior project for the Math and Science Academy, and it's kind of traditional that you do something you're interested in, because why do a project if you aren't interested in
Yeah.
it? So I did mine on medicine, and so far in the process, I have done all of my research and kind of capacity building is what they call it for your project. And then I'm about to start my actual mentorship for my project in August. So I did my capacity building. I shadowed a trauma surgeon and general surgeon, and I loved it. Absolutely best time of my life. I'm pretty sure, I'm almost certain this is what I want to do.
Yeah. And that is an absolutely just a story where you can take away a lot of things. And I'm so sorry for your loss. Um And but I genuinely do think that you like hearing your story, I genuinely do think you are a very strong human being for going through that. And with the healthcare malpractice there and everything like that. And was this a big part on almost kind of creating reform? Is that a big part of why you want to become a healthcare practitioner?
Absolutely.
Yeah.
Yeah. The kind of, we are very lucky that we had so much family in that hospital room to advocate for my grandpa, because he couldn't do it himself. He wasn't well enough to do it. All the other hospital rooms did not have that much family who was advocating for them. And when you're sick in a hospital room, advocating for yourself should be the last of your worries. And
Yeah.
that's a big part of why I want to be a doctor. Nobody should have to worry about that.
Yeah, absolutely. Um, and because you want to become a doctor, but more specifically work in the ICU and ER, like part of the hospital, could you explain why you would like to go into that part?
Yeah, simply part of that's because I don't really want an office job. I want a job that's going to change a lot, be interesting each and new day. But then again, it's super rewarding because you're facing people who are having the worst days of their lives, are in under enormous amount of stress, are sometimes ecstatic and not in their right mind. And being able to do something about that, able to act, is precious because you're giving them a fighting chance. So it's something my grandpa never had. And I can't lie, Grey's Anatomy,
Yeah.
yeah, that's a big part of it.
I love Grey's Anatomy as well. Um, so yeah, absolutely. I think there's a big part with just advocation and then also facing these people one on one. Also shows like The Pit is also a great example of like the ER specifically. Um, so you throughout your high school journey with medicine, do you have some key takeaways or learning points that you have sort of gained?
Yeah. Yeah, in general, um, it's a lot, but my main focus has in the last part been stress. I've been diagnosed with an ulcer because I stress myself out so incredibly bad, and it triggers migraines and all that. But it's important to know that like you need stress to live. You can't function without some degree of stress. So finding that balance in your everyday life has been a challenge for me both in sports and school. It's I'm not I'm not exactly sure if that's what you're asking, but like,
Yeah, that is.
yeah.
Yeah. And yeah, and I think that it is important to also kind of just understand yourself, especially when we're going into the medical field, because if you don't know yourself, then there's a big chance that helping other people may be a little bit of a struggle there. So actually, a big part of yourself is playing sports. So you play sports, specifically softball. So what if any medical experiences have you learned from this sport? So for example, maybe an injury you have seen on a teammate, maybe an injury you sustained yourself, or maybe you were just potentially in like an athletic trainer room one day and you saw somebody who may be playing a different sport having an injury. So what are just some things that you kind of learned?
Yeah, so I grew extremely fast, very quickly, 18 inches in 1 year.
Oh,
It's not it's not good. Um, so my spinal alignment has been absolutely terrible. And if there's anything I've learned from that part is when you fix one part, the other part goes out of whack.
Mhm.
So I've been to physical therapy 6 times now in my life. And it it feels at a certain point kind of hopeless that you're never going to be able to get out of that, but sometimes doing nothing, I've learned, is better than doing something. And I
Mhm.
know that sounds hard. Trust me, as a athlete, you're trained to attack everything, put all your work, hard work forth to do something. But for example, I was faced with a consequence of getting an MRI or not because you had to wait 6 months to get the MRI. But if you don't get the MRI, maybe you do have a tear or a tendon issue. I hurt my arm. I tore both my labrum and my UCL in one.
Yikes.
Yeah.
Ooh.
So the issue becomes is if you get the MRI, you're going to know if it's actually torn or not, but you're exposing yourself to radiation and there's nothing they can do for you still. Like the MRI just tells you if you know if it's actually a tear. There's no way to actually fix that tear because it wasn't torn enough that surgery would have been plausible. So the idea behind doing less actually gets you more. It sucks sometimes, but that was the better option for me. And
Yeah.
I think that's extremely hard to understand for people. You want to do as much as you can, but that can actually harm you.
Yeah, absolutely. I think that is also just a big takeaway in general, because just in healthcare, from what I've seen, what I've shadowed, it is a big thing that sometimes you just can't do a lot. So with this sort of experience and everything, how do you plan to kind of give this to patients, especially if you want to work in the ER or the ICU?
I'm a big believer in giving all the options, but highlighting the risks. And one thing I really wish they did with my grandpa that they didn't is they never told us all the options. We
Mm.
were given one option, and then if somebody asked a question, the medical professionals seemed overly irritated sometimes when they suggested something else because we didn't know the risks behind those other options, but we were never told, so it felt like we were kept in the dark. And I feel like that's one of those patient doctor interactions. They want to know everything they can to make their best decision. And that way, the doctor and the patient are on the same page. And it makes the decisions go through a lot smoother.
Yeah, absolutely. Just knowing all the options is, I think, one of the biggest things that you need to have as a healthcare provider to give to your patients, because that's the biggest part of being a healthcare provider is giving your patients that security and comfort. So, do you believe that sports have enhanced your understanding of medicine?
Absolutely. For example, quality over quantity, like quality of life, is a huge part. In softball, every time you step out onto that field, you're risking a ball getting hit back at you. And if it hits your heart at the wrong moment, it can stop your heart. As a pitcher, I'm only 37 feet away from when that batter hits that ball. And it comes off the bat a lot harder than it comes out of my hand.
Yeah.
So the idea behind you are playing with a known risk that you could get injured and pretty badly. It takes a great deal of passion and love to still do that activity at a high level. And for some medical professionals to just disregard that passion, it hurts me because my sister tore her ACL twice and tore her meniscus twice. And the doctors were just like, you should stop playing. And she's like, it's not that easy. Doctors that don't have a prior sports experience don't understand that because they've never had it taken away from them. And
Hmm.
I feel like sports have given me that perspective to understand that value.
Mhm. And I think that just ties in back into when we were talking about you want to give all your options. And I think sports allows you to be able to look and actually recognize those options. Because I like play tennis and I like understand a lot of the risks. I've seen people on my tennis team have those risks. There's a lot of things that come into play when you're playing sports, but at the end of the day, it is still such a great passion to have. So, speaking of passions, you definitely have a passion for doctors being overworked and understaffed and finding a solution for it. This is exhibited in your senior project. What brought you to this topic for your senior project?
Right. So back to my grandpa again. Uh, the negligence of the doctors. The one doctor was flat out negligent that just left and didn't show back up. But when we were actually in the hospital, they were so understaffed that when the call button was called for help, nurses wouldn't show up until like 30 minutes later. And you can't even blame them because there's one nurse running an entire floor of 200 hospital rooms. And from what I know, there's beds that line the hallways. There's more patients in this hospital than there are rooms. It's impossible to treat everyone in there. And it sucks because they get burnout and the patients suffer from bad outcomes.
Mhm.
So I got into this idea of how can I solve the fact that doctors have to care for way too many patients in a given time, and then how can I solve the bad outcomes that these people are having as a result of the negligence. So I looked into stress factors because the idea is if I can lower stress in the environment, less accidents occur, less patients go to the ER, less patients there are to take care of. And then the more time each doctor can spend per patient, the better outcomes patients should have, the less doctor burnout, and then a higher doctor employment rate because they're less burnout, which in turn should then lower stress in the workplace again. So, ideally, in my senior project, I want to create a product that can lower stress. And that in itself is a very hard task to do. But the idea is less stress correlates to less understaffment, and that would solve all our issues.
Yeah, absolutely. Because it turns into like a cycle of sorts when it's either going to be a very negative cycle or a very positive cycle, depending on the stress levels of the physicians, of the nurses, of like everybody that works in the hospital. And I think that what your project and I think what you're doing is absolutely amazing, and it's absolutely something that should be explored, especially since we're looking at this happening in the current day throughout not only just the US, but all over the world. It's just happening over and over again. We're seeing this sort of pattern of understaffed and overworked doctors, and especially in like the field you want to go in, ER, ICU, there's a big burnout rate. So, what are some steps that you are taking to sort of reach a solution to your problem that you're researching? I know that you said you wanted to create a product, but do you have in mind like any sort of um, I guess, like prototype or maybe just like an idea of sorts of what this product would be?
Right. So, with my given resources, it's likely to be some sort of survey or informational um, resource because if I can educate people that stress is bad to some degree, ideally, if they could control it or even just limit it, it would help. But I am working with a new ICU doctor who works with like, I would say his name, but I'm not sure if he wants me to, so I won't. But he works a lot with bigger issues globally and he has a lot further outreach. So ideally, if I could do something bigger impact, I'm going to work with him to do that. But right now, I'm settling for a survey because I have to have a way I need to measure people's like the success of my survey through that to get for my senior project anyways. And I plan to publish a research as well with all my iSearch and senior project stuff when it's all done.
Yeah, absolutely. And I think, again, this is just an amazing project that you're doing. And I think you're like just the steps you're taking to just look into this at first is just something that we just need in our community, in the world, honestly. So those were all my questions for you today. Thank you so much for letting me interview you. Um, yeah, and I hope everyone has a great day.
Thank you.
Absolutely.